I'd looked at a few practices through the years prior to the current projects that we're doing or have just finished, and nothing was just quite the right fit. And then we had the opportunity to partnership with the Southwest Health Center and do kind of a collaborative, medical dental, model. And that came about. I kind of started talking to the CEO maybe 3 or 4 years ago regarding that. It was always on the table. I always knew I wanted to have multiple practices, and this just kind of kicked it off and made it become real. CAD/CAM was number one because I'd never practiced without it. So, that was always on the wish list. As I started getting involved in doing some implant stuff, we looked at lasers. So, and originally when I came back, it was non-digital. So, becoming a digital practice, having digital x-ray, and then cone beam was also a big one that fits into everything we're doing with implants as well. So, cone beam, CAD/CAM, and laser, the Solia. So, they've all been kind of on the wish list, and have been thankful to be able to employ them all. Most kids, don't have a lot of previous dental experience. And so trying to set them up with a positive experience from day one can affect their whole dental outlook for their lives. So I have a whole generation of kids that have never had anesthetic done for, even though they've had extensive restorations, 6, 8, 10 fillings, but they've never been numb. Well, they come in and they're leaning back and watching a video on the monitor above them, and the Solia laser allows us to comfortably provide restorative dental work without anesthesia, and that's huge. If you don't have to go that, if you can bypass the anesthesia route and by using the Solia, it's a practice builder, because now all of a sudden mom tells her friends and they call, and you got new patients calling because, hey, I heard you can do a filling without numbing it. There's lots of other things with Solia that you can do, but to me that's been the most value. It's evolving probably faster than what we're able to keep up with, which is a good thing. We use it currently for, printing surgical guides. That's probably our top usage, because we do a lot of implant stuff, and everything we do is surgically guided. But we print Brux guards, occlusal guards. So it's changing. We have 3D printed crowns, so that's a new technology, and the fit's amazing. So just the ability and the materials are improving so fast. You just need to stay adept on what you can and can't do, and then getting the staff kind of onboarded into the process. So more you can do in-house is the better fit for the patient, and the patients are more likely to receiving care there, and word-of-mouth referrals. So it's been a kind of a whirlwind that's continuing to impress me.
When we started discussing opening an additional location, that's why we started looking into Fuse. We wanted something that was cloud-based, that we could access, at the time, our first additional office, that we could access both offices just from anywhere. So I think that's the main reason why we made the switch.
Fuse is something that allows us to access the patient charts and all the information, from any location. I can look at an x-ray and be talking to one of my associates at a different practice, and we can, be talking about, hey, what should we be doing here? And, so we can interact, we can provide the best patient care by doing that. It's been a great cloud-based option for, us trying to grow, in practice number. We've had a good relationship with all of them, and kind of friends. I have all their cell phone numbers, and I can text any one of them at any point about anything. So it's just been a great relationship for all 17 years that I've been in practice.
What's really fun is we've seen his growth, right? There's nothing more rewarding than seeing people blossom and their businesses grow and flourish. So we're channel partners, and we've done it together, and it's a really solid relationship.
And if it wasn't for Patterson's support, I don't know if I would have branched out like that. Just the ability for them to lay it all out and give me quotes on everything, and being able to go to a showroom and look at the equipment and sit down and say, I like this. It's really made it easy.